CYTO365 is the name of the Swedish medtech company with over 100 patents. And today I have with me Micael Törnblom, the CEO of the company. Welcome.
Thank you. Thank you for being here.
Please tell me more about your innovation and 100 patents.
Yes. And yeah, it all started when I was an airline pilot and I was flying. And I know that we as a pilot make many mistakes each flight. You perhaps don't want to know this, but that's the truth. But we're two in the cockpit. We have checklists to take care of everything and multi-level safety in the systems. And while I was with my wife at the hospital, I witnessed her getting treatment with the infusion therapy with a lot of drugs. And I recognized there's an underlying risk that they could perhaps mix. And she had a friend working at AVA at the time, patent firm, and that's how it came to be to file my first patent. And how we have 100 now is because one of the world's greatest companies licensed the first 3 patent families out to them, and they paid for every patent basically. And then I got it back 5 years ago, and so now they're mine again, and now we are developing the product ourselves instead.
So I see some products here.
Yes.
Tell me more.
The basic idea is that when you receive infusion therapy today, you have a primary line, but then you have multiple Y ports here.
Yeah.
So when you connect your secondary drugs, it's very easy to open them simultaneously, but you should almost never do that. So I invented a turn valve instead that easily can position towards the drug that should be given to the patient. So basically that's the whole idea behind the product. The product name is Rondello. Yeah.
And you can have this directly or?
Correct. So this will then be on the patient in different locations. Yeah. So
and do you have any competitions today?
Well, we do have the legacy IV sets. What I mean by that is the old way of doing things. That's our competition. The old way of doing things would be a primary IV line that I just told you about with multiple Y sites. We do think that we also have a lot of improvements to be made, where you have a manifold close to the patient, like here, a 3-way stopcock or multi-gang manifold it's called. And when you give treatment there, you actually leave a lot of residual drugs. But if you would use a device like this, all the drug will actually run through and end up in the drip chamber and then eventually to the patient. So you would actually save a lot of drug if you use it like this with a drip chamber below. So we're also trying to convert a lot of other ways of doing things. So that would be, I would guess that would be our competition then. Yeah.
So you have a lot of environmental impact as well?
Absolutely. Actually, you leave about 2 meters in a line, in an IV tubing line today, which is about 7 milliliters, perhaps even more, 10 milliliters per treatment. And a mini bag is 50 liters. So every 5 times or every 7 times, you would save the cost of 1 drug bag. And if you think about it, I don't have any data, but I would assume it costs a lot, and also environmental impact to produce the drug itself that you actually could have then to the patient instead.
Which market are you approaching first?
We were by chance actually going into US first, because that was the fastest customer for us. We started by selling it as a component first, because a component doesn't need to have a CE mark or a 510K. It's sold as a component for further manufacturing. So that was our first customer. Now we have customers in Brazil, Netherlands, Italy, Spain, Austria, Nordic countries, Taiwan for the whole IV sets. So yeah.
But not Sweden?
Well, Nordic countries we have.
Okay.
So yeah, absolutely. But it's now introduced and training, and it will be launched any week now, basically, by our partner. Yes, we partner with distributors, so we not ourselves go to hospitals.
So we should keep an eye on
Yes, you should.
to see when the launch is coming.
Yes, you should. I believe it could be Aniva in Helsingborg. Is it within 2 weeks or something? Yes.
And what milestones should investors expect from you in the coming year?
Yes. So we do have our own product catalog. Sorry, I should have brought it up before, but I can do it now.
No problem. That's perfect.
So actually, you talk a lot about the certification process when you talk about drug development that a lot of companies pitching here. With medtech, it's quite much easier. This CE mark of the devices itself, or 510K when you go to US. So all this catalog here, we have 84 different versions of the IV sets we are now bringing to the market. And they just now have a CE mark approved with MDR. And we received the first batch sterilized to us 19th of September, and then we're delivering to customers.
Wow.
Yeah, so that's a huge milestone.
Absolutely.
Of course.
And the last question, probably have already said a lot about it, but you can just summarize it very shortly. Why is this a good investment case?
Well, if you compare us with other startups, there's a lot of talk of patent pendings. We have patents approved, and we have the major markets, US, Europe, China, India. We have trademarks also approved. Those things takes a lot of time and a lot of money, and we have done that. Certification, we have done that. We have done industrialization. We have built our own clean room in Helsingborg with full automation, and also invested in multi-cavity tools for the production of the injection molded parts, because we are backed by the European Union EIC accelerator. So already now 5 million euros have been invested roughly in the company. So when you come in now, we are having the most risk behind us. We have now the commercial risk remaining. Obviously, we don't know how fast orders will come, but we have a very good knowledge about the market, very good network, very good pricing strategy. So the time is now to come in, because we are commercializing. Now the fun starts.
That sounds great. Thank you so much for being here with us today. I will keep this.
Yes, of course, it's yours.
Thank you so much.
Thank you.
And good luck.
Thank you.